back. Dr. James Jarvis from Northern Light Health is here once again. Thank you so much for joining us. We're talking about artificial intelligence today and where it intersects with healthcare. And I think that it is a multifaceted topic. So I guess I would ask you, where and how is artificial intelligence being explored or used at the moment with Northern Light?
Yeah, so once again, thank you for having me here, Brian. Yeah, so we've been using artificial intelligence in a lot of different areas. And when we talk about artificial intelligence, I think it seems a little bit scary, but we're really talking about using computers with a lot of data to try to make assistance to us. And so, you know, the first kind of things that I noticed with us using artificial intelligence was around things like medication safety. So a physician could write a prescription for a medication and you get an alert saying, hey, this might might react with another medication the patient was on. But we use it in other areas as well. Pathologists have been using this for a while to kind of overread microscopic specimens like pap smears. Radiologists have been doing the same thing to overread mammograms, all with the intent of looking at those to try to see if they can find an abnormality that maybe got missed by a human being and therefore maybe pick up a cancer a little bit earlier.
So when you say that to me, I think there are benefits to it. Will patients see benefits to this? But I also worry about privacy concerns. Who's looking at my information? Where's it going? Where are the benefits? Should there be concerns?
Yeah, so I'll answer the first part and then the second one about privacy. So yes, I think patients already have the benefit of it. They're just not aware of it. So again, if your mammogram was read by machine learning and picked up a cancer earlier, you probably didn't even know that was involved in the process. But you also see it in other areas where, for scheduling, we now have online scheduling. That's all being done in the background by a computer. So I think there are some benefits that you're seeing there. As far as the privacy concerns go, I think they're real. Anytime that we have large amounts of data, there's always a risk there. Northern Light Health takes a prime way of trying to prevent any kind of breaches or incorrect sharing of information. And so we really take your privacy very seriously, but there certainly is that concern and needs to be thought about.
It seems like a lot of the stuff will be behind the scenes with artificial intelligence. Are there other ways in operations or to help productivity that we might see?
Yeah, so we've already had a few of our practices who actually have been using artificial intelligence to actually help generate medical records. So while you're in talking to your provider, there's actually a program in the background that's actually sitting there and going through and making sure that the note is actually reflective of the visit. This is really important because, one, it saves the provider time. So the provider now can spend more time with you. The physician can be asking you more questions, getting to know you a little bit better. And then on top of that, the note now captures everything so that your medical record is more accurate than it would be if we just relied on somebody to be typing that in.
Do you envision AI being used in medical research or education to help benefit patients?
Yeah, absolutely. And again, we already start seeing this. So as we collect more large amounts of data, and we can actually use computers to analyze that and come up with algorithms. So I talked about the safety issue. We actually have built in already some safety issues within our computer that actually checks the medical record, looks at people's vital signs, does things like that, and can actually alert providers when your condition may be worsening sooner than we can pick that up. So one of the prime examples of that is something called a sepsis alert. So sepsis is a life-threatening infection. The computer sometimes can pick that up sooner than we can and alert us that, hey, maybe this patient's in trouble, so we can interact with it earlier. We're trying to expand that now to find other things that we can look at so we can kind of predict these poorer outcomes sooner. We may actually be able to a point where we can actually look at your entire medical picture and then predict whether you are at higher risk of having something like diabetes or heart failure if you don't change certain aspects of your life. And so that can help us then to even prevent people from having hospitalizations or even dying early by being able to make those predictive things. On the education front, one of the things that I find so exciting, because I'm involved in education all the time, is the fact that we can actually use some of this artificial intelligence to ask a question of the computer to get a real-time answer, so that we're actually getting more up-to-date, more relevant medical information. In the past, it could take as long as 17 years before we figured something out, and it actually then is at the bedside. We're now trying to get that done in months rather than years, so that providers are actually providing today's medicine when you need it.
It's a huge, broad topic. It's a a major, I guess, asset. It's so powerful, just a matter of harnessing it and deploying it in the right way is what it sounds like.
Yeah, absolutely. And with everything, there's always risks. And so we've already seen some of those risks. One of the risks that we've seen is that some insurance companies are using AI algorithms to determine whether or not you can get a test paid for. But the problem with that is that computers still lack some basic functions. They can't tell the nuance in our voices. They can't really understand exactly human emotions. And because of that, I still think we're going to have real live doctors in the room with you, and that can help to make the difference in making those subtle changes, because everybody's an individual, not everybody's disease is the same, and we really need to remember that.
Interesting stuff. For more information, you go to northernlighthealth.org, northernlighthealth.org. Thank you so much for joining us.